Hello, good afternoon, one and all. This is Dr. Chandrakant Galdhar. I'm getting a number of call messages from clinical practitioners. Sir, could you help us for how to read the thyroid report? So we decided that why we should not prepare one 10 or 15-minute presentation where we can give some guideline so that clinical practitioners they can get some help how to read the thyroid report. So we have decided the topic that from confusion to clarity, canine thyroid report. So before reading the report, just we will go through the hypothyroidism. The definition of the hypothyroidism is here lack of thyroid hormone secretion or action. Both the things could be there. One, there could be secretion, it means thyroid hormone secretion or its action, they are going to be compromised. And because of that, hypothyroidism is going to be developed in the patient. Most often, reduced thyroid hormone secretion by thyroid gland is the predominant cause for hypothyroidism. And mostly the hypothyroidism is reported very common disorder of dog and rare in cats. So this is the brief information about the hypothyroidism. In the definition, that lack of the thyroid hormone secretion or its action, it is most important. We can see here when doing the classification, primary hypothyroidism is there where 95% of the clinical cases we are getting in our routine veterinary clinical practice where destruction of the thyroid gland and 75 to 80% of gland is going to be destroyed there, and because of that unavailability of the thyroid hormone uh, is there in that cases, so that 95% primary hypothyroidism clinical cases we are getting, where secondary hypothyroidism where TSH decreased TSH are often part of the pituitary insufficiency, and tertiary hypothyroidism decreased TRH very rare and not reported in the literature, but theoretically tertiary hypothyroidism clinical cases we can suspect or expect theoretically. So, but the references they are not available in the veterinary literature. Now, when we are going to see the clinical finding as far as the hypothyroidism is concerned, we know the patient they are mostly or owner they are mostly reporting when there is hair loss. So, pet parent with hypothyroid dogs seek veterinary care when the dermatological problem is there. Okay, where dryness of the hair coat, excessive shedding, retarded growth of hair. They are the common clinical findings available. We can see other clinical finding in adult onset primary hypothyroidism. We can get lethargy, hair loss, obesity, weight gain, dry hair coat, hyperpigmentation, hypothermia, bradycardia, constipation or diarrhea, myopathy, polyneuropathy, secondary infections, and reproductive signs. But, but predominantly in our veterinary clinical practice, when patient reported in the primary clinic or in first clinic, okay, lethargy, hair loss, and obesity, they are the predominant clinical finding we are getting. So obesity at the same time hair loss or alopecia or skin issues, they are maximally reported by the pet owner when they reporting to the veterinary clinics. Now, what are the laboratory investigations we are generally recommending? Yes, of course, CBC, biochemistry, then urine analysis, radiograph, and ECG. And apart from this, most important is the thyroid testing. Okay, we are doing the thyroid testing here. Thyroid testing we are doing. This thyroid testing is important to rule out whether it is classical hypothyroidism, non-thyroid illness, or euthyroidism. So in thyroid testing, what are the current methods available? The current methods available are radioimmun assay, CLI, chemiluminescence assay, and ELISA, enzyme linked immunosorbent assay. So these are the common assays in human at the same time in veterinary clinical practice we are using. Here, radioimmun assay we are commonly using. As far as the thyroid testing panel is there, in this blue line you can see, in this blue line or this in this blue box you can see this is the thyroid panel available. Okay, this thyroid panel is for the human use where TSH, total T4, free T4, FT4, total T3, free T3, reverse T3, T antibodies, T4 antibodies or thyroid antibodies, T4 antibodies, TG antibodies. They are commonly used as a thyroid testing panel in human diagnosis of the thyroid dysfunction in the human. However, the key points in the veterinary we can see here, we are using TSH, we are using TSH, total, we are using TSH, total T4, FT4. They are commonly screened for the dog. T3 is mostly intracellular, so T3 is less useful for diagnosis. However, total T4 and FT4 commonly screened for cats. So when we are going to see the canine hypothyroidism, so most important thing is that TSH, total T4, FT4 and total T3 generally we are using. This we will discuss in the next slide. The commonly used method ELISA, CLIA, RIA, where RIA is gold standard, where smaller to smaller concentration of the enzymes, smaller to smaller concentration or magnitude of the hormones we can estimate. In easier or precision or accuracy is more in readiness. Now, thyroid testing in veterinary clinical practice, they are generally using TSH, total T4, total T3 and free T4. So when patient come to you and when you are suspecting that this particular patient is suffering with the thyroid dysfunction, so what is the usual protocol? Generally, we recommend we need to take a history, then inspection of the patient, then clinical examination of the patient. After that, we need to do a laboratory investigation where thyroid testing is important. And in thyroid testing in veterinary clinical practice, we are using TSH, total T4, total T3 and free T4. So these are the four parameters. They must be there in your diagnostic panel. But every parameter having some advantages and they need to cross check with the existing disease condition if available. Now, as far as the veterinary clinical practice is concerned, thyroid testing, TSH limitations are there. Why TSH limitation or why we are using the TSH? Thyroid testing and TSH limitation. We know elevated level are expected in hypothyroidism. Means TSH level they are going to be increased in subclinical and this could be our goal. If we are getting subclinical hypothyroidism, if we are going to target subclinical hypothyroidism, we can manage the patient in early stage. Again, as far as the TSH or thyrotropin is concerned, this is the diagnostic screening test in human endocrinology. Yes, of course, in humans, they are going to be used TSH. However, fact in our veterinary clinical practice that up to 38% of hypothyroid dogs do not show an elevated TSH. These are the scientific report finding where we are missing almost 38% of the hypothyroid dogs who are having the hypothyroidism but won't get the elevated TSH. They can get a normal or deviation is not up to our diagnostic accuracy or up to our diagnostic suggestions. Currently, canine assay cannot reliably distinguish very small and it means currently canine assay as far as the TSH cannot reliably distinguish very small changes and low level of the TSH. So it is challenging when we are using the thyroid testing that to use of canine TSH, it is the wisdom of the veterinarian who are going to correlate the things clinically. Second hormone, thyroid testing, it is total thyroxine. Total thyroxine is nothing but TT4, where reduced level are expected in hypothyroidism. Consider NTS. NTS, they are nothing but non-thyroid illness during the interpretation and lower in dogs than human. Now, this is the interesting point. In dog, concentration of total T4 is comparatively very low as compared to human. In human, normal thyroid total T4 concentration is ranging from 60 to 100 nanomole per liter. However, in dog maximum 30. It is going to range from the 20 to 30 nanomole per liter. So when we are considering the total T4 and its comparison with the human being, we need to use our veterinary reference range for giving the opinion or decision on the thyroid hormone. So why I am telling this all? Because we should get this background is important, that we should get an idea of this background, how to read the report and how to give the interpretation. So before interpreting, we must understand what is the reference range for the thyroid hormone in dogs. This is the research article published by our research group, where we have established the reference range for total T3, total T4 and FT4 in healthy dog. So once we get idea about the reference range in the healthy dog, we can give our opinion on the hyperthyroidism or hypothyroidism or euthyroid illness. So what is the output in this research article that we will see? We can see a result here, the establishment of the thyroid profile data, total T4. What is the unit here? Unit is nanomole per liter. So here we can see the T bars available. These are the T bar. This is T bar and T bar. This T bars available, they represent the data which is equal to range. So range is 3.86 to 64.35, but it is not a true range, or it is not a range that we need to use in the clinical practice. Then box interpret the middle half of the data. It is nothing but 25th, and next point we will discuss horizontal bar. This is the horizontal bar in the box is median of the data. This is about the references. What is the T bar? T bar is the represent the data which is equal to range. This is the range. Then box represent. This is the box. This box represent the middle half of the data, and horizontal bar in the box is median of the data. Okay, but how to read this graph? Results were interpreted as a percentile and displayed graphically as a plot. And here reference range for the hormone concentration were established by use of the non-parametric method of percentile estimation, where 25th to 75th percentile range we are using. So 25th 15.70 nanomole per liter to 35.29 nanomole per liter. This is our reference range for total T4. I'm again repeating how to read this particular graph. Here 3.86 to 64.35, it is T bar and they are equal to range. However, this is the box. This box represents the middle half of the data. Okay, and horizontal line here, it is nothing but the box is median of the data. Okay, and reference range of the hormone concentration was established by using the non-parametric method of percentile estimation, 25th to 75th percentile for the result. Okay, so 15.70 to 35.29, this is the reference range for us, means, and 24.54 is the median, and here we can see 28.17 is the mean of total T4. Now it is very interesting. Now mean is 28.37, here median is 24.54 and range 15.70 to 35.29. Means if we have get a patient whose range is in between 15.70 to 30.29, we can expect, and no clinical at the same time no classical symptoms are available, we can expect yes, it could be a euthyroid clinical case. But if values they are less than 15.70 with uh, uh, predominant clinical finding of hypothyroidism, like I told, increase in body weight, then hair issues, or that skin issues, then we can suspect yes, there could be hypothyroidism in the patient. Similarly, total T3 and FT4 data we established. Here reference range is 0.88 to 1.51 and unit is nanomole per liter. And in FT4, this reference range is 7.8 to 14.75. See, in both the slide I told, in this slide and earlier slide I told that units are most important. So for total T3 and total T4, unit we are going to be used are nanomole per liter. However, for FT4, we are using the unit picomole per liter. Okay. Now here we can see reference range established here. In this present study, all the reference range 28.17 for total T4, total T3 1.29, FT4 13.03. Unit is picomole per liter for FT4, for total T3 and total T4. Unit is nanomole per liter. What are the established reference range is there, that all the established reference range, they are correlating with the national and international findings. Now, what are the available units we are getting? We need to see the available unit when we are getting any report. When we are getting any report here, in the report maximally these units are there. Okay, total T3 ng per ml, total T4 microgram per dl, and ft4 nanogram per ml. Normalize here, the first step, how to read the report. In that, normalization of the unit or its magnitude is most important. So always keep all the unit same. So what are the unit we need to use? Total T3, we need to use the unit nanomole per liter, total T4 nanomole per liter, and FT4 picomole per liter. So normalization of the unit is most important. How to normalize the unit? I will let you know, or I am going to explain the next slide. You can see here how to do it. Yeah. So this is the simple formula for total T3. When we are getting the units in nanogram per ml, we need to add a conversion factor or multiply with the conversion factor 1.536. So final answer we will get in nanomole per liter. For total T4 tridimensional unit, or in our report generally we are getting microgram per dl, and here 12.872 nanomole. This conversion factor we need to use, multiply with that value, and we will get the result in nanomole per liter. Same for FT4, we are getting the result in ng per dl. Conversion factor for this 12.872, and final values we will get in picomole per liter. So some labs, they are giving the report in SI unit. For example, nanomole per liter, and picomole per liter. However, if some lab, they are giving the report of total T3 in ng per ml, total T4 in microgram per dl, and FT4 with ng per dl, you need to use this conversion factor and make our normalization of the unit for reading the report and interpretation of the report. There are some online softwares or online apps or online conversion systems. They are also available. Generally, we are using this units lab system, where we are, it means whatever the lab report we are getting, we are mentioning that report here in this. Okay, microgram per dl, we will get the result. Now we can see here, we analyze the practical clinical case here. In this case, total T3 is 0.38, unit is ng per ml. We need to convert it in the hormonal value in nanomole per liter. So what is the conversion factor we need to use? 1.536. At the same time, total T4 also 1.52 microgram per dl. So what we need to convert it by using the conversion factor. What is the conversion factor here? 12.872. So simply we will do the calculation. For example, just open your calci. In the calci, just do 0.38 multiplied by 1.536. What is the value? 0.583. Okay. Same for total T4. What is the value we are getting? 1.52 multiplied by 12.872. What is the 12.87? Just a minute, I am doing it. 1.52 multiplied by 12.872. So final result of 19.56. Okay. So this is the way First, we need to do a conversion. Just we need to convert the things. What are the units available in your report? If we are getting the report in nanomole per liter or picomole, for example, total T3 nanomole per liter, total T4 nanomole per liter, and FT4 in picomole per liter, then it's fine. There is no issue. Okay, but if we are getting report in Ng per ml, microgram per dl, then you need to do a conversion of the unit. Here I am not discussing about the TSH. Today we are discussing about the total T3, total T4 and FT4 that I am generally and commonly using in my veterinary endocrinology practice to give my opinion on thyroid dysfunction available with the patients. Now for practice I am giving you this dummy example. Okay, free T4 1.52, you just convert it in picomole per liter and nanomole per liter. Now again I am repeating, total T3 nanomole per liter, total T4 nanomole per liter, and free T4 it should be in picomole per liter. So for practice I am giving this slide, these values, you just calculate and communicate the same to me. Thank you. Hope you understand how we need to see the report. In next presentation, I will let you know how to do interpretation of the report. With this, thank you.